you, Jill, for accepting my invitation and I welcome you on this episode of Eclectica. And I'm so happy that you are a guest on my podcast today.
Well, I appreciate the invitation.
So I think I have a lot of questions, and we are talking about a very, very important and interesting thing, that how dental providers can help cancer patients. So I think you are the right person in this space to talk about today. And but before we go into the our conversation on this topic, I would really like to know how you came up with your venture of side effect support, and what is your journey like? So I think that would really inspire all of us.
Well, before I started my program for the dental hygiene degree, I was a dental assistant. And when I started that first job, my mom received a breast cancer diagnosis at that same time. So just watching her journey and seeing how badly she suffered with side effects in her mouth and the little to no guidance that she received from her medical team just really demonstrated what a lack of information there was, not only on the patient side, but also on the provider side. Because I often say, I really foolishly thought, now that I worked in the dental field, I would easily be able to find these answers for her. It only made sense that problems inside of the mouth would be something that the dental professionals would know how to handle. And then I found out that really wasn't the case either. So there's just this huge disconnect between the medical oncology field, the dental field, that's really doing a disservice to our patients. And that really showed in so many instances throughout the years, that it kept inspiring me to learn more and realizing that it's not easy to always learn a lot about this subject. It's hard to find the information. It's very time consuming. So I wanted to create a resource that I wish that I had. And I put together something that not only serves the patient side, but also the provider side, to help educate us and know how to better serve our patients.
Wow, that is very interesting. And I understand your source of inspiration, which is, I think any good thing starts with the experience that we face in our own life, probably. Jill, can you explain us about the importance of dental care for patients who have been diagnosed with cancer?
Yes, for patients who are going into treatments that already have active decay or infection inside of their mouth, they are much more likely to have complications during the treatment process, than more likely to have serious infection risks. And there are so many things that we can do as dental providers to help reduce those infection risks and help make that process during treatments easier for them, but also help them to have better health throughout survivorship. Because unfortunately, a lot of the problems that they can experience during the treatment process can lead to damage that they could be dealing with for years after the treatments are complete, or for some people, depending on the types of treatments, they could be dealing it with for the rest of their lives. So if we can anticipate maybe what some of those complications may be, address them before they even have a chance to start, we can help to make the process much easier for them.
Yeah. Thank you for that answer, Jill. What do you think, or what has been your experience? Like, what are some common oral health issues that cancer patients may face during their treatment? What are the common things you think you have encountered in your experience?
By far the most common, and I think the ones our minds tend to go to first, are the dry mouth issues. Dry mouth obviously is such a huge problem with so many medications, both prescription and over the counter, and these patients are on a huge list of medications, and maybe many years after their treatments are complete. And also, obviously, with radiation, that can alter salivary flow and the quality of the saliva. But then also oral mucositis is a huge concern, where they can develop ulcerations in the tissue, that those open sores then are much more likely to become an infection source. But there's also the ones that you don't always think about. The dry mouth obviously can lead to more risk for decay and for periodontal disease, and their mouth becomes acidic, so they're more likely to have tooth erosion issues. They could be on antidepressants, which might cause some bruxism issues. There's so many combinations of these medications, and a lot of times they're given types of steroids, or there may be a hormonal suppression that can affect bone mineral density. So sometimes it's quite a combination, and a recipe of things that all come together to cause their own unique issues.
Right, right. I think you have very well put all the most common things that these cancer patients orally what can be perceived. How can dental professionals could collaborate with oncologists and other healthcare professionals to ensure a better or more comprehensive care for patients?
And that's probably our biggest challenge, is that communication gap, and
Yes.
just having the opportunity to see these patients. So that, depending on the types of cancer treatments, or the cancer that they've been diagnosed with, most people do have a window of time between diagnosis and actually starting their treatments. And that would be the ideal window where we could be part of the process, where we can take care of some of these immediate concerns before they enter into treatments. That would be ideal, is just having that ability to have the access to these patients, which doesn't always happen. So sometimes it can really be a benefit to reach out to the oncology professionals in your area. Let them know that you are there to help serve them and their patients. And if they do have patients that maybe don't have what we'd say maybe a dental home, a dentist that they call their own, that to keep you in mind, that you want to help serve these patients, you want to help make sure that they're going in with the best chance for a successful outcome, and just creating those relationships, I think, is going to be one of the biggest ways to make a change.
Right, that's very, very correctly put. Actually, I think collaboration, and as you rightly said, the gap of communication. I think a lot of work is happening, but still more needs to be done in this space. You know? Yeah.
Definitely.
Yeah. So, Jill, I would like to understand that. Do you think, or can you share any specific considerations that dental providers should keep in mind while treating cancer patients, such as those with probably they're going through radiation therapy or chemotherapies? Are there any specific recommendations for dental practitioners that they should follow?
Yes, and that's where communication with their oncology team is important, that if they are in the treatment process, you do need to have that communication to make sure that they can safely be treated, because that always has to be done in respect to their blood counts. Most of the treatments will suppress their blood counts as far as their white cells, their platelets, and we need to make sure that they are in safe ranges, that they don't have out of control bleeding issues or excessive infection risks. And we may need to look at antibiotic prophylaxis possibly. They may have an indwelling port that we need to have coverage with antibiotics, things like that. So that part of the communication is great, but then also just the ability to educate the patients in a way that provides them the best chance to help themselves, and in a way that isn't frightening to them. And I think that's one thing that we can provide the information, but do it in a way to say that, these are the treatments that you're going to be having. These are the potential complications. So now that we know that those are potentially going to occur, let's see what we can do to help minimize them or just avoid them altogether, just by making some simple changes. And I think that's one of the things that gets lost in the shuffle sometimes, is that it is such a complicated subject. So we tend to assume that all the answers are really complicated for them as well. And sometimes they're so simple, just using, an extra soft compact head toothbrush, looking at the tools that they're using, looking at the products that they're using. Are they using products that have irritating detergents that may accentuate the risk for mouth sores? The flavors that they're using, doing something that's either non-flavored or very mild flavored. Even children's flavor sometimes can be so much easier for them to keep brushing and remove that bacterial burden inside of their mouth, versus something that's really like a sharp peppermint, cinnamon, things like that can be much too irritating for them. So sometimes it's just the simple things we can do that really do make a big difference.
Yeah, I think Jill, that was a very interesting answer, and I think yeah, as you correctly said, that with small things starts a day. So same way, I think sometimes we forget getting into the complexity of cancer treatment, education. We tend to forget small things, but I think that's very important. The points that you have shared with us, I think it's really valuable. And whoever is listening to us today, if you are a dental practitioner, I think this conversation is really going to help you a lot. So, Jill, I'll move to my next question to you. I have a long list, by the way. So, Jill, could you share some insights into the potential side effects of cancer treatments on oral health, and how actually can dental providers could manage them when they are encountering, such kind of side effects, or they are seeing something clinically. So, can you help us with that?
Sure. Well, again, if we can have that opportunity to see somebody early and reduce anything that can cause potential irritation inside of the mouth, and obviously that's going to be removing any active decay, any active infection. If you have hopeless teeth, hopefully getting those out of there before they start into treatments and have that immunosuppression, but then starting them out again on certain products that are gentle, mild, educating them on the importance of keeping their mouth clean. It's been shown that the more bacterial plaque, the higher the bacterial burden inside of the mouth, the more likely they will have oral mucositis problems, the more likely that they may develop bloodstream infections, respiratory infections. So most of it is really patient education, because that is the last thing on their mind. They're dealing with some pretty big issues in right now, just not only in their physical realm, but financially, the time constraints that they're dealing with, and being mindful of all of that, that if we can help to lessen that burden for them just through, educating them on how they can help themselves, I think is really a great opportunity for us. But again, it's really looking at their unique medical history, their unique treatment plan, taking in consideration their dental history. Is somebody going in with a really healthy mouth versus somebody that already has a lot of challenges? We can kind of put those puzzle pieces together and devise specific plans for them.
Yeah, absolutely, absolutely. So, what kind of measures or preventive measures can actually the dental professionals can recommend to cancer patients to maintain their oral health during or any after treatment, any kind of therapy that they will be going through. So, any tips from you on that?
Sure. Looking at fluoride applications, are they somebody that would benefit from custom trays? And realizing that if we create custom trays for them, that they understand there may be processes during the treatment time that they may not be able to tolerate them, and to let them know that that's okay, that if nausea or tender tissue or something prevents them from being able to continue using them on a daily basis, just back off during that time, and then they can resume when they're able to, because a lot of times they may go through times where it gets really hard to use them, and then it may get a little easier, and it's kind of a roller coaster through the whole treatment process. But so fluorides are huge. If we can do fluoride varnish treatments and remove some of that ability for them to have to follow through on things, where we can take care of that. Silver diamine fluoride is a great option. There's really showing that we can not only arrest active decay, and possibly, especially if you have somebody that comes in and just has too much to get done before they start their treatment process, can we arrest some of these areas? Silver diamine fluoride, put glass ionomer over that, smooth the area out, hold it over until they're more medically stable, and then we can go back and do a more permanent restoration for them. And then the silver diamine fluoride too is great for decay prevention. So can we treat the areas that are going to be susceptible to decay, and really give them a little extra protection in the process?
Thank you, Jill, for those practical insights. And I think in day-to-day practice, when dental practitioners, particularly, I would say, not very experienced ones, when they are landing up and they sometimes have to deal with such patients, I think your insights, if they're listening to this podcast, then your insights will really help them, because these are small things but very effective, and it comes as a note of support when you are actually encountering a patient as a dental professional at that point of your clinic or on the chair. So I think it's very important to understand these things. So Jill, as you were talking about this provisions, but I would also like to understand that are there any specific dental treatments or procedures that may need to be altered or postponed for cancer patients?
Yeah, and again, a lot of that will be part of their blood counts. But depending on their treatments, also, I do believe that there's an increased number of patients that are at risk and will be at risk for medication-related osteonecrosis of the jaw because of an expanded amount of targeted therapies that are coming out that do affect blood flow. One of the ways that cancer grows and spreads is through angiogenesis, the creation of blood vessels. So there are different types of targeted therapies that reduce that, which put our patients at risk. So if we know patients are going to be taking some of these medications, or if they're doing, the bisphosphonates, or those types of bone building medications that also put them at risk, before they start those treatments, to anticipate, are any of these teeth potentially going to need extractions? Get that done before they start these medications, because once those meds start, they stay in the system for a very long time. And if they need an extraction while they're at risk, that can be very dangerous for them. That can really put them into a cycle that is hard to get out of.
Oh, I think this is something which is very valuable to know, because I think these are practically, sometimes people just overlook these things, right? It's because cancer is so dicey, and every time, in any case, like when you are in a dental clinic, I think it's a very challenging position as a dental professional, because you really need to keep abreast of all these things. And so probably, Jill, I think a stress on the medical history, the dental history, personal habit history would be a good thing. Uh, what do you think? I mean, that would be a good thing to focus for the dental professional, particularly when they get a history of cancer treatment, or probably they are existing cancer patients.
Yes, definitely. If somebody, you definitely need a med list, and to research those medications and make sure if there is anything that would be a complication for us. And I think that is going to be one of the biggest things to look for right now, is making sure that we are treating them safely as far as risk for the osteonecrosis, because once they start those meds, then we're in a tough spot. So if we can reach them before they start them, that would be ideal to remove the potential.
Right, right. So, like as you already mentioned, that many, xerostomia, or probably commonly called as dry mouth. So, this is common side effect of many cancer patients, like during the treatment or post treatment. So, how can actually dental providers help to alleviate this symptom and improve the patient's comfort?
The good thing is that there's so many over-the-counter products that are available, and that number just keeps growing, because dry mouth is such a huge problem for so many people. And I think with the baby boomers getting into that generation now, where they're taking a lot of medications and things like that, companies are taking note, and they know there's a huge market out there. So there's going to be many, many more options on the market. But really, it's important, I think, for dental providers to do their research on the products that they're recommending. That was one of the things that I guess I was really most surprised about when I started side effect support and really started looking into products more, is how many are on the market that maybe aren't very good choices for our patients. They may give them that initial feeling of relief, which is great. We want them to be comfortable, but with long-term use could actually contribute to damaging their teeth. There are many that are acidic, and our dry mouth patients already have an acidic environment in their mouth, and then we're keeping acidic products in there on top of it. So it's really hard for them to get back into that remineralization stage. As they go through that demineralization, remineralization, they just hover in that acidic state. So looking at the pH of the products, I think, is really important and something that is often overlooked.
Thank you, Jill, for that very practical insight. So, what would be your advice to dental providers on how exactly they should approach and communicate their cancer patients who may be anxious or fearful, definitely, about the dental treatment? Because anyway, they are dealing a lot. They would be dealing a lot with the cancer itself. So, yeah.
Yes, and that is probably the biggest thing, is just approaching it with empathy, really understanding that they have a lot on their plate. Being at the dentist is not where they want to be at that point either, which we are, all, I guess, all used to as dental providers. But again, approaching things in a way that isn't frightening to them. I think they're going in with, well, most people with a high level of anxiety and fear already, and just as an example, somebody that would be at risk for osteonecrosis, we certainly wouldn't want to approach it in a way that it would scare them, that they would say, I'm not dealing with this, and would refuse to have the treatments done, which could be a possibility if it's not handled properly. So we always need to approach things in a way to say, these are potential side effects of your treatments. So let's just do everything we can to help make it easier for you. If we can prevent them, possibly, if we can minimize them or at least delay the onset, all of those are great things. It's just, we need you to have the information. And one of the things I did with side effect support is I created a patient informational brochure. It's available for free on my site. Right now I have it in English in Spanish for adults, and English and Spanish for children. I would love at some point to start having those translated into other languages, and they can just be downloaded for free and printed. So it's a nice little tool that you can use as a communication for patients to go through step by step with some of the problems, what they may experience, and really simple tips.
Thank you, Jill, for providing information about that free resource that you have on your website. So, would you like to mention your website so that if anybody is interested, they can get a hang of that and they can download that resource that you have provided?
Yeah, I'd love to. It's called Side Effect Support. So it's SIDEEFFECT SUPPORT.com. And I have it split up into different sections for patients and for providers. So there is a resources section where the free printable brochures are available along with other free resources. Then there are also blog sections, and I split those up that has informational and educational articles that help to just provide easy access to information. And I think that was one thing too. When I said I wanted to provide a resource that I wish I had, there's so many different organizations, and it's hard to figure out, where do I find all these different things, or do I have to become a member to all these things? So I try to take a lot of these different resources and then put them into one easy to access spot for people. So it cuts down some of the legwork and the time and the stress that it takes to find these things. I do also have a small over-counter product shop tab. I do actually have access to teledentistry services through the teledentist. So if somebody has an emergency, a question, and they just need to talk with a professional or possibly have a prescription call in or something like that, they have access to that too.
Wow, I think you are all over the space, and thank you, thank you for that, what you are doing, and thank you so much for what you are doing, and please continue doing that. I think it's a very wonderful approach that you have taken to give it a wholesome wholesome paraphernalia. So just like you were talking about the resources that you've developed, and you have been working in this space for quite a long time. So I was just wondering that do you have any examples or success stories to share, that where you have seen or you have experienced probably, that how dental providers have positively impacted the oral health and overall well-being of cancer patients? Anything that comes to your mind that you'd like to share with us?
Yeah, and there's so many, and so many are just little nice comments. I can't tell you how excited I get when I have somebody that reaches back out and says, I tried these things that you recommended, and I slept through the night for the first time because I didn't wake up with my mouth so dry that I had to keep getting up and drinking water or feeling like I was choking. I think the one example that will always stick out most in my mind is we had a young local lady that was 22 years old that was diagnosed with multiple myeloma, and she was going to be starting a bone marrow transplant process. And unfortunately, her medical providers never mentioned anything about her mouth. Actually, they never recommended that she see a dentist beforehand. And just through a strange series of coincidence, I ended up having a connection with them and mentioned, if you have not seen a dentist, make sure that you go in, because I knew that with this type of cancer, she would most likely be receiving a type of medication that would put her at risk for osteonecrosis. And also, when her immune system would be so suppressed, she's going to be so susceptible to infections. So we were able to get her in. Thankfully, I work for a very kind and generous dentist. We got her in. She actually had 6 areas of decay. She needed endo on one of the teeth, and then she had all of her 4 wisdom teeth in there yet. So we pulled a few strings and got all 4 wisdom teeth taken out, and we got her started on all the preventive measures. And she went in, she actually had 2 transplants, one which is called autologous, which is like with your own stem cells, and then that prepares her to have one for donated cells from her sister. And she went through both transplants and did not have one single ulceration in her mouth. And
Wow.
I never want to claim that was, everything that we did, but I can't imagine if she would have went into that situation with that decay and that infection and those wisdom teeth. It just scares me to think of what she could have been dealing with, or if she might have not even survived it, with being so susceptible to infection.
Right, right. I think this is a wonderful story that it actually inspires, because see, just small steps actually help the person, and that is, she's
Mm-hmm.
so young and already she's suffering. Amazing, amazing. Thank you so much. So Jill, in your opinion, what do you think would be like, we are taught in a dental school in a certain way, understanding the pathologies, trying understanding techniques, learning techniques to treat them. But then, in your opinion, what additional training or education should dental providers consider to enhance their ability to provide optimal care for particularly cancer patients?
And you hit the nail on the head that there's just very little information that's provided to us in our
Yes.
dental school or dental hygiene programs. So it really is on us to take those extra efforts and initiative to seek out the courses. And thankfully, a lot of conferences are realizing that there is a need for this and helping to provide speakers that can provide some extra education. Utilizing side effect support is a great idea, to have access to the articles and the documentation and studies. And what I try to do is really stay up to date on the latest information with that. But then also, there are some organizations that are taking note of this too. One example, there is an organization called the National Network for Healthcare Hygienists in the U.S. That just started an oncology certificate program, and I'm actually one of the instructors with it. So hygienists can take this series of courses, learn about all different aspects of oncology, and better be able to serve their patients. And then if there are opportunities where we can have more collaboration, where you might have a hygienist that could be working in a hospital setting and directly with the patients, that they have that background and knowledge to start doing that. So there are some things that are taking place, but we're still kind of in the baby stages with it, I think.
Yes, but I think anything, when we think bigger, there is always a start point. So I think that's required, and that you say that people are realizing the importance of this kind of
Mm-hmm.
education training is very, very important, because I think education is the only weapon, knowledge is the only weapon that makes us powerful, and we can take our steps ahead accordingly in whatever area we are providing our services. So yeah, I think, Jill, it is very interesting conversation that is going on right now, and I feel to keep you holding for all the day, but that's not possible. So probably I will just, this would be my last question. Like, what resources or support networks are available for dental providers who actually wish to expand their knowledge and skills in caring for cancer patients?
So there are a couple organizations that really are great ones to follow and become members of if you want to learn more about the subject and want the most accurate, updated information. And one is called the MASCC. It's the Multinational Association for Supportive Care in Cancer. It's a mouthful. And they have an offshoot that is the International Society for Oral Oncology. And they have great information on their site and a lot of updates. And this is kind of where, when hospital systems and everybody take what the most accurate recommendations are, this is the most well-respected agency to do that. So, and anybody can become a member, and you can stay up to date with that. So I would suggest anybody that wants to stay informed and better serve your patients, that would be a great one to look into.
Great. Thank you, Jill. Thank you so much for being here again on the podcast and sharing all your insights and experiences. And it was a very insightful conversation. We have learned a lot. And all those who you are listening today to this podcast or you will be hearing the recorded version. Whatever it is, I think you have a lot of things to take notes. So I think a pen and paper is a must when you sit for this particular episode. So thank you, Jill, once again, and I think we will meet soon in the future again for some more interesting conversations like this.
I'd appreciate that. Thank you.
Thank you. Bye-bye.